financial illiteracy is the biggest financial crisis that we have going on in the world, not only our country. And so that's a mission I could get behind, and I want to make a difference in this way.
Hi, this is Jeri from Touching Hearts at Home here in Coeur d'Alene, Idaho. Today, I'm interviewing one of my very good friends, Kim Carlson, actually from Sandpoint, which is north of here quite a ways. And she's a financial strategist, and I will let her introduce herself.
So yes, financial strategist, focused on education, and my mission is literacy.
Can you clarify with us, for our audience, the difference between Medicare, Medicaid, long-term care insurance, and how we care or how we pay for either services like in-home care or nursing home, anything like that? What would your take be on that?
Experience with that is my husband's grandmother had dementia and was in a long-term care facility. And the facility itself was awesome, but we learned a lot of things on the fly that we just, I would say we didn't know how to prepare for that. And so we did not go into that super prepared. Medicare is federal health insurance, and you qualify, there's like layers of qualification for that. So you qualify for the beginning of that when you turn 65, or if you have a disability. And I don't know the specifics of the disability. But that doesn't get you everything. So there are additional, part of it's hospitalization, part of it's prescription, part of it's doctor visits, and it's all in layers, and it's not all free. So you have to buy your packages, and that's about as in-depth as I know on Medicare. Any additional thoughts on that one?
Oh, I just wanted to say that I have had conversations with some potential clients that assumed that their Medicare was going to pay for in-home care. It does not pay for in-home care. It only pays for home health, hospital stays, and nursing homes. And each one of those is very minor in the amount of time that each person gets. And there's a rolling calendar of when they can go back into the hospital. The importance of that is if someone's hospitalized and on Medicare, once they go out of the hospital, it is the hospital's job to keep them out of the hospital, because if the person goes back into the hospital shortly, in a very short amount of time, and there's a window of time, I think it's 30 days, that person's care will not be paid for from the hospital. I mean, the hospital will have to pay that. Medicare will not pay for that. So the hospitals have incentive to keep people out of the hospital, and that's something that in-home care can keep people out of the hospital much longer, to keep them healthier, and it's a strategy to ensure that people are healthier.
Wow. Okay. So there's Medicare, Medicaid. Medicaid is when you're at the point where you need full-time care. Am I correct on that?
Medicaid is state-funded insurance.
Okay.
It will pay for in-home care. Our office does not do Medicaid. There are very few and far between in-home cares in this area that take Medicaid because their reimbursement rate is so low. It's very hard to run a business with a lot of Medicaid patients. That's unfortunate for a lot of people, but for you, it's important to be proactive for your long-term health insurance, as well as life insurance, health insurance, things like that, that will make a difference in the long term for you. So you'll have more choices.
Right. So what I focus on is protection of assets and the family. And, if you are utilizing the Medicaid program, there's rules you have to follow, right? So you can still own your home, but you have to live in your home. Otherwise, that's an asset that that makes you not qualify. So you have to qualify.
Yes.
And then you're allowed to
Mhm.
keep certain things like $2,000 in the bank,
Mhm.
your home if you live there, your car if you're using it. So it's very restrictive.
If you're unable to drive or unable to stay safely in your home, those
Mhm.
assets would have to be sold and
Mhm.
used for care. And it's between 1 and 3 years that you have a spin down process of private assets before you can access your Medicaid. That is super important information that most people don't understand. So I would highly encourage
Yeah.
you to get well versed in that kind of information.
So you cannot quit claim the deed of your home over to your family before you go into Medicaid. That is not going to work, because even if you do that, or even if you sell it and give the money away, you have to come up with that money for your care. Yeah.
Right.
Then
And
long-term
then what's
insurance,
that?
or do you have any other thoughts on that?
I think if there's any other further questions, I would believe that calling me with a little bit more question specifically about your particular needs. Every person is super different. I'm actually teaching at the local library on a regular basis to instruct
That's so
people to
awesome.
know how to use their assets accordingly and who to reach out to for experts like Kim that can work through assets specifically. So the last one was long-term care insurance. Do you know how that is accessed and able to be used in-home care or any other?
Well, long-term care insurance as a standalone policy, I'm not super knowledgeable in. I know that my mother-in-law has that and she feels good. I know that it has its rules too. So you have to be at the point where you cannot perform 2 or 3 of the 6 basic functions before that you qualify for that to start being used. I also know that like I had the terminal illness rider on my life insurance policy. You can also put a long-term care rider on a life insurance policy. And that's a pretty inexpensive way to have a chunk of money that's available to you for your care in your older age. So that allows you to access that death benefit, not 100% like a lump sum, but it allows you to access that toward your care. So
Mhm.
that's a really good tool for people that a lot of people don't utilize.
That's amazing. I didn't actually know that either until more recently in the last year or two. But the great thing is it doesn't have boundaries on what it can be used for. Like Medicare, you
Yeah.
can't use it for in-home care. Long-term care insurance, you can, but there's just some jumps to, or some hoops to jump for the business supplying the in-home care. It can also be used for adult apartments, I believe, not positive about that, but definitely for assisted living and any skilled nursing that can also be used for. So the other thing to know is just because you have that accessible to you, it may take 30 to 60 to 90 days to receive any monies from them, just because there's an elimination period, which means that just because you have it, it takes them, a time frame for them to give it to you for those uh, purchases for healthcare expenses. So just know that ahead of time.
Yeah. So really we should have like an emergency fund that's liquid available for that transition period.
Mm-hmm.
Yeah.
Mm-hmm.
My business in Sandpoint is How Money Works Learning Center. And so you can get a hold of me on my website, howmoneyworks.com/Kim Carlson. And my phone number and my calendar is on there. I believe it has my email on there too. So
Great. Well, this has been a fabulous discussion, very relevant for the clients that we serve, and I look forward to talking to you soon.
thanks, Jeri.
Thank you.